Right, Noelle. So, I'm Mackenzie. I'll be your student massage therapist today. So,
Hello.
how are we doing? What are you coming in for?
Doing okay today. Today's a better one than some of the others, but it's just my right side, like right in my butt, my glute. It's just been hurting a lot more lately, and it's been going up into sort of I want to say the back of my pelvis and between my shoulder blades has been feeling extra. I want to say achy, almost like fatigued, and at the base of my skull, just everything. But yeah.
Do you find you're getting like headaches and stuff like that as well?
Yeah,
Or,
sort of right at the back there. I'm sure it's just not drinking enough water or whatnot. But yeah, sometimes I just get that ache at the base of my skull, and it really just seems to grow.
well, I'm sorry to hear that, but hopefully we can do something about that and help you relax a little bit and feel a little bit better in your body today.
That sounds great.
All right. So, with your pregnancy, well, which pregnancy are you on currently?
This is my third.
Okay, nice.
Yeah.
How's it going so far?
This one's been putting up a bit of a fight.
Okay.
I feel like I got off real easy with the first two, and this little one is just determined to leave their mark before they're even in the world. But it's okay. All things considered, I'm very fortunate. No complications.
All right. No, like high blood pressure or anything like that.
A little bit. It comes and goes. I find pretty much as soon as I do anything, it really skyrockets. But then I just stop doing that thing and yell at my wife to take over, and you know,
Fair enough. I mean,
she's fine with it.
Okay.
For the record.
Yes, yes, of course. And does your OB or like general practitioner say anything like regarding the high blood pressure, or is it controlled?
They were saying it's mostly like under control. There's no like wild sporadic spikes. It's not really happening when I'm at rest. It's really just if I push it a little hard, then it really starts going. But it's not just kind of high for quote no reason. I guess if that makes sense.
So is it gestational hypertension, or did you have this
That
before?
no, I didn't. That sounds familiar.
Okay.
I feel like he's used that term before.
Okay. And so when's your expected due date?
We're getting pretty close. It's about 3 weeks off now. I
wow.
think. Yeah. What would that be? The 20th, June 20th, I think.
Probably, yeah.
Yeah, we're getting there. It's close. We're excited, but we're also scrambling.
It's nerve wracking for sure. I mean, there's
Yeah.
a lot happening, and
You think every time it's like by pregnancy 3, third kid, we've done it before. That doesn't get easier.
no, it never. It's just like, oh, another person.
It's just
Let's
more.
add him in. Yeah, of course. So yeah, you said that you're coming in for some
Yes.
butt pain, some like right in that SI low back sort of
Yeah,
area.
that's sort of like that little bump right there.
Yes.
Yes.
A little bony spot, or a
Yeah.
little dimple, depending.
That's the one. That's the
Okay.
one.
Alrighty, and then some pain in the back
Mhm.
between your shoulder blades and the base of your skull.
Yeah. They
So-
sort of feel like just one big unit back there.
All right, and like if you had to like characterize the pain, like put like a word towards it, what would that? Where's that going for?
Down in my butthole region, definitely it's a bit more of like a pinch, like a really like a sharp little poke right
Okay.
where that bony bump is, that SI that you said,
Mhm.
and then up sort of in my back and my neck. It's really just this like dull kind of ache. It kind of sometimes it can feel like I don't want to say burn, but when you
Okay.
work a muscle too much and it
Mhm.
just feels like it's getting hot, like
It's there.
it's just
for sure.
unrelenting. It's there.
It's
That's
there.
that's a great word for it.
All right. So, and does it ever like refer anywhere else, or does it stay pretty local? You find?
My shoulder blades and neck is pretty local, but I find
Okay.
sometimes in my butt it kind of goes down the back of my thigh a little
Okay.
bit. Nothing crazy.
All right. And so I see on your health history that you are taking a couple medications
Mhm.
or just over the counter drugs to help with the overall condition. So I see that you are on a medication called Zoloft. So could you tell me a little bit more about that? Like why you're taking it and everything?
I'm taking it mainly for anxiety. That's just been a long treated thing. It's usually fine. It just compounds with the nausea that I'm already getting from pregnancy. So sometimes that can be a little worse. And I find some days, even before the pregnancy, I would just get kind of foggy. Like,
Okay.
nothing crazy, but just a little bit of not enough coffee in the world
Yeah.
can snap me out of it. That
Yeah.
sort of thing.
That's That's a hard one to battle for sure. It's an uphill battle.
But I would say I'll take that over the alternative. So
Yes, of course. And does that give you any side effects that you can note, or just
not really. Again, just those sort of like general feelings, but no sort of major. I'm not getting any major swings. I'm not having any like major gut trouble or anything like that. So
good to hear. And you also take an antacid as well for acid reflux. Does that come on a little bit more with pregnancy, or have you always sort of had that?
Always had it.
Okay.
Definitely love spicy food a little bit too much, I would say.
That's
in
the
the
best.
pregnancy. It's really nice.
It's all you need.
Some days you still just have to risk it. You just go for it. But definitely since the pregnancy, everything's just we'll say a little bit more squished around.
Okay.
So it's a little bit more pronounced.
All right. So,
but no, the antacids they've been pulling their weight.
Okay, good. Alrighty, and so with the discomfort that you're coming in with, does this ever like affect like activities of daily living or like any functional issues that you've noticed?
Yeah, a little bit. I find for the most part, like I don't do a whole lot of driving these days. But even if I'm in the passenger and I'm like trying to help co-pilot, I find like just with that discomfort in my neck and upper back, like looking over my shoulders is a little bit uncomfortable. And then with my sort of like lower glute region, that one's been tough. When I still want to be engaged with my other two children, you know, I'm pregnant. I'm not an invalid.
Yes.
So things like I want to garden with them. I want to play in the sandbox with them. But you know, that sort of prolonged stooping, it can really flare it up. So.
Okay. Yeah. So it's affecting, you know, how you're interacting with your kids and whatnot. So like with regarding this therapy, regarding those like functional goals, what do you want to get out of massage? So if you left this session today and you're like, you know what, this was a really good session. I'm feeling really good. What does that look like for you?
I feel like for today, for me, even just reducing how much aching is going on in my back and neck is a big one.
Okay.
That would probably be just a weight off, because not having that constant ache throughout everything it would feel really, really nice. The leg one, we can work on that one a lot, but it's a little bit more sporadic than what's going on in my shoulders and neck. So
but this one's really,
just that little bit of
aggravating
relief.
you.
Yes, something that I don't have to think about. That would be a big A+ for me.
And I'm sure it can be a lot like harder to like hold your kids, other kids, and everything like that. So yeah, I think that's definitely something we can address today and sort of get in there, check it out. I'm sort of proposing a little bit of a like regarding like the assessment, doing like a postural assessment to see how like the change in like the weight from baby has really altered like your posture and whatnot, which could be potentially contributing to the ache in your back and in your pelvis as well.
Gotcha.
And also doing a little bit of like a palpatory assessment, so just touching the different areas that you've marked as discomfort. So then we can see if there's any trigger points or like high tone in there and just check it out, so then I can direct my treatment towards these specific goals and issues that you're looking to get done today.
Awesome. That all sounds great.
All right. And one more thing I do just want to ask you a little bit about
Of course.
is, so I was going to ask you a couple common like symptoms that women and other people can get during pregnancy.
Okay.
So I just want to know if you experience these, just so I can also just see what's going on.
Yeah, just cover the bases. Yeah. I like that.
Have you experienced any like edema or anything in your legs?
Edema being
so like swelling in your feet and your legs.
Yes.
Yes.
Yeah,
Okay.
nothing too bad, but the occasional, if I'm up and about, then when it's couch time, they just they go up on the rest, course. And then nothing major, but yeah.
Okay. Right. Have you noticed any like varicose veins or like burning or anything in your legs?
Not too much.
Okay, good. How's sleeping? Are you having any trouble sleeping with insomnia, restlessness?
Not so much. I would say any sort of sleep discomfort comes from if I roll and I kind of get that little pinch in the back of my glute. That might cause me to wake up a little bit, and I have to pee a lot. So there's that. That's
that's definitely one for sure.
Butt hurt, pee lots.
thank you for this interview, and I look forward to our treatment.
Me too.